This is a book review for the book Life Reconstructed by Kim Harms. I am a lymphedema therapist and an oncology massage therapist, so I am going to target this book review towards my fellow manual lymphatic drainage therapists. I think this is a great book to read to teach us more about the lived experiences of our clients that have had breast cancer and reconstructive surgery when we help them with manual lymphatic drainage after their implant and explant surgeries. And it's also a really great resource if there's a specific client that you have in mind, whether you massage someone regularly and now they're just coming and telling you that they or a loved one had a recent breast cancer diagnosis. So let's get in a little bit to what specifically this book covers. Then I'll talk about how the book addresses clinician presence. So there are definitely some tips in here that we can take and make the way we as massage therapists help our clients more effective. I'll also talk about specific things that massage therapists can pull from this book, make us more effective therapists. We'll talk about some of the major themes of the book, and then we'll talk about some little tidbits, specific advice that I think is really great that I read in this book. So first, if you're looking to possibly recommend this book to a client or a loved one, it's important to know that Kim Harms is a Christian, and she shares very beautifully how she used her Christianity to guide her through her breast cancer journey, from mastectomy, reconstruction, and she also talks a little bit about how after her first breast implants were put in, she found out they were recalled, and so that she had to go into another operation to explant and replace her implants. She also shares throughout the book the stories of several other women who have also gone through the breast cancer journey. So first, I'd like to talk about clinician presence, and she points out some very important things that I think it's valuable for us to take as her journey through the breast cancer, from the diagnosis to the going for reconstruction and talking to the different surgeons. Specifically, the bad. So let's cover the bad first. She talks about how she went into one plastic surgeon's waiting room and it really reminded her of Miami Vice. And she contrasts that with going into another plastic surgeon's waiting room that was much more like beige and normal, but it made her feel comfortable enough. So that's something that we can definitely take back and look at our offices. Are our offices welcoming to clients, especially when they're going through an emotional journey? Or are they, glitzy, glammy, look like Miami Vice meets the Jetsons? And she also talks about in one of her consultations with the surgeon, she had to disrobe to get the examination, but then the surgeon left her unclothed and tried to discuss things with her while she was unclothed from the waist up for the entire rest of the consult. And we have to understand that it's necessary for us during the massage to, undrape a body part as we're working on it, but that doesn't mean that the client should be undraped and just left like naked on the table during their lymphatic massage. And this goes for any client, but especially the client who's been through surgery, who is feeling vulnerable at that time. And she also talks about a physician that she really liked, but the physician was oblivious to her levels of physical pain and kind of didn't understand how much each part of the breast cancer reconstruction could be painful. And she was specifically talking about the inserts that they do to expand the breast tissue, the expanders. And that is, I've heard from everybody, that's an uncomfortable to very painful part of the breast cancer reconstruction. So we should know, physicians should know, surgeons should know, everyone should know that is not something you can just minimize. We have to understand that some parts of this treatment are going to be painful, and we have to communicate to the client, to the patient, that we know this is painful. And to the good, she really described the good experience, how she knew that this was a medical professional she wanted to work with, because the medical professional made her feel like it was a team decision. she had a consult and she felt like it wasn't just the surgeon telling her what would happen, but let's discuss options and come to a decision as a team, the both of them. And that's something very positive that we can take towards our interaction with the client. Let it be a team decision. Give them some power and control over their care. So specifically for massage therapists, I love how she mentions that after her surgery, when she had her expanders in, she was pretty much forced to be a back sleeper. It was very uncomfortable to sleep on her side. And we can take this into our massage sessions and ask ourselves, what kind of massage in the neck, in the back, would I give a client who was a side sleeper and now they're forced to be a back sleeper after their surgery? We also see this with our facelift clients. They're forced to be a back sleeper, sleeping elevated, sleeping with bolsters underneath of their legs if they have the deep flap. And how is that going to be improved somewhat if we can give them a nice, relaxing massage and hopefully temporarily reduce some of that pain that they have from being in this unusual to them sleeping position. And sleep is so important. I love that she mentioned this during the book. That is one of the top most consistent responses that I have after I give clients manual lymphatic drainage and massage after their breast reconstruction, and the doctor sends them to me for MLD after they get liposuction and the breast augmentation, is they slept really well that night. They're sleeping better since they had their first massage. And I think it's not something we talk enough about. I love that she spoke so fervently about the importance of sleep in the book, because I think it's very important, and maybe it's not something that we're mentioning as being important in the recovery from your surgery. She also has another voice in the book. Like I said, she shares many stories of other women in the book. And this was actually part of Kathy's story, where Kathy talked about she had scar massage after her deep flap, and the massage after her deep flap helped her to recover more fully from that operation. She also talks about in this book, Kim Harms, about the differences between breast reconstruction and cosmetic breast augmentation. And I think we definitely need to understand that. And she kind of reiterates several times during this book, that having breast reconstruction is not the same as, oh, look, you got a boob job. Oh, look, now you get to choose what kind of breasts you have. There are definite differences between breast reconstruction and breast augmentation. And especially, we need to be cognizant of the fact that if someone has a breast augmentation, like a cosmetic breast augmentation, they started out with some breast tissue. And if someone has a reconstruction after a mastectomy, that breast tissue has been removed. So it's a different beast altogether. She, I think, talks more about how other people react to it, and how if you're getting advice from someone who had a cosmetic breast augmentation, that's not going to be necessarily useful advice for someone who had a breast reconstruction. And she also talks about and names a few drugs, pharmaceuticals that can be prescribed for improving intimacy and improving the libido for the woman. So it's important for us, if we're having clients that are after their breast reconstruction, that are after their breast cancer, that these drugs may be on your health history form, and just it's great to be able to read the book and understand why those drugs are there, why the client may be using those drugs. So the third section I'll cover, so we've kind of covered clinician presence, we've covered some specific tips that massage therapists can take from the book. The third one I want to talk about is the major themes of the book, which I thought were very valuable. She shares information on grieving. And you can grieve even though you didn't die of breast cancer. There's still the grief from having like your breasts removed and having to go through all this surgery. It's okay to grieve. She talks in detail about sexual intimacy, and I like that she talks about it from a Christian perspective. So this would be a good book for someone who has an active Christian faith. They would really be able to take some something from each section of this book because it's by a Christian author. She has a section for husband's advice, and her husband talks a little bit about his advice, and she shares a book which is specifically for breast cancer husbands, and she shares that she really recommends that book for someone to read if they want more information and more advice from the husband's perspective. She talks about talking to children, and then what I really liked is not only she covered talking to children and then younger children versus older children, but also reaching out and emailing your children's friends, so your children's friends' parents, your children's friends' family, to make sure that they know, and to make sure that they know, just don't make it weird. We want life to be as usual and normal as possible for our children. So if that means if your kids were coming to the house before, we still want your kids to come over to the house and hang out afterwards. Let's make this as least painful as possible for the children in this family that's dealing with a breast cancer diagnosis and treatment. And she also talks about faith. She talks about her faith throughout the book, her Christian faith. So some specific tips that I really liked to draw out and share with you. I like the idea that she specifically came out and said that she's coming to terms with living in a body that she no longer recognizes as her own. And I love that gem. I love that pearl. And I love to have that idea in my head and communicate that idea to you, that just because even if you sent people pictures of the before breast and the surgeon did a fantastic job with the reconstruction, the breasts aren't going to be your own breasts. The breasts aren't going to feel normal and like they're a part of you at first. And they may be perkier, they may be a different shape, they may be a different size. And it's not something that is going to be like you just wake up and it's just like it was yesterday if you have immediate reconstruction or even delayed reconstruction. She also shares a story on how important it is to have someone stay with you at the hospital. And definitely I had someone stay with me after my cosmetic surgery, a nurse, and then my husband was there with me. The idea that you shouldn't go through this alone, even if you're at the hospital. She had a really, really good tip, which is make sure your shower is big enough to fit a shower chair and your husband and the person that's going to help you shower. And I would even take it a step further and kind of do a dry run of that. If your client had time, can you fit your husband in a shower chair? And how is your husband going to give you a shower after your breast cancer surgery? And kind of work out before you have the surgery how that's going to happen after the surgery. We can always, make do in the first couple days with wet wipes, but sometimes you just want to have a nice full shower. And make sure you have access to a shower that fits both you, shower chair, because you want to sit down, you don't want to fall over, and the person who is going to shower you. She also talks about pillows, and she talks about bolsters, and she talks about that wraparound mastectomy pillow. And I have another video on YouTube that is kind of a review of one of the mastectomy wraparound pillows, so you can kind of see exactly what that is and what the benefits of that pillow are. She also talks about on page 75 an interesting trick of laying a pair of leggings crosswise on the bed and then lying on top of those leggings, and then when you need to slide off of the bed, someone can just pull those leggings to the side from underneath you, and then they will help pull the legs over to the side of the bed. It's those little tips like that I really love, and those little tips that I think, being so widely read and reading so many books, kind of gives us these ideas as massage therapists that we can share with our clients. The idea that I usually give for transitioning on and off the bed is you could also use what are those plastic mattress covers that you use if the kid's still peeing the bed. That lets that plastic surface, instead of that mattress, often lets you slide easier off the bed. And then if your bed is high If your mattress is high, you can use a step stool. So those are my 2 tips that I've kind of picked up and I share with clients. But the more we read, the more we understand the lived experience of what clients are going through their breast cancer journey and breast reconstructive journey, the more valuable, the more empathetic, sympathetic, compassionate we can be for our clients as they're going through that journey.